Hello there, I'm Dr. Purnendu Roy. I'm a surgeon in Genesis Hospital, Kasba, Kolkata. Today is 24th of March. It's World Tuberculosis Day. Have you ever thought that why is each day marked like this? Some days Mother's Day, some days Anti-Tobacco Day, some days Tuberculosis Day. There is a background history behind all of this. Why 24th of March? Because in 1882 in Berlin, Dr. Robert Koch described that he has discovered the causative agent for the disease tuberculosis, Mycobacterium tuberculosis. It's shocking and sad that every day we lose 4,100 people from tuberculosis disease, and every day over 30,000 people actually get infected with tuberculosis, even though this is a treatable and preventable disease. And today, 24th of March, we are commemorating World Tuberculosis Day. Every year we have a theme, and this year 2022 the theme is Invest to End Tuberculosis and Save Lives. The purpose of having this theme, the purpose of having a day, so that we can make people aware that look, even today we are losing so many lives, tuberculosis, which is a preventable disease, and we can make certain protocols and what are plannings and then execute accordingly. We must try and prevent tuberculosis, end tuberculosis, just like we have managed to end smallpox. Tuberculosis is one of the deadliest infection, and WHO has been working on it, and we were gradually getting control and it was on the decline. But in last 2 years of COVID, suddenly it has been noticed that the incidence of tuberculosis is on the rise. So now WHO feels that we should ramp up the resources available and start action in research as well as treatment protocol to get a control on the spread of this very deadly disease called tuberculosis. We are losing a large number of lives. We only think of certain things which is new, but just because tuberculosis has been there for such a long time, people are not able to understand the number of lives that we are losing. So what is tuberculosis? The disease was known even 8,000 years BC. Now, the Mycobacterium tuberculosis, this is an infective causative agent which enter into the human body and cause different types of organ involvement. Depending upon the organ where it involves, tuberculosis can be of different variation or types. When it involves the lung, it's called pulmonary tuberculosis. They can be active or inactive. People who are coughing out blood, and that can actually spread to other people. Those who are in a latent stage, they can be inactive form of tuberculosis. There can be glandular tuberculosis. People can have matted neck glands, and that causes pus formation. The pus which forms in tuberculosis is called cold abscess. Normally, a boil or an abscess is red and hot, and it's warm on the skin. But tuberculous abscess is not hot, it is actually, that's why called cold abscess. Tuberculosis can also involve the brain in many forms. One is Tuberculos Meningitis, the other is called tuberculoma, when there is an area which appears like SOL, space occupying lesion, and can actually mimic like a tumor in the brain. Tuberculosis can form in the intestinal tract, in abdomen, in which sometimes intestinal tuberculosis can cause strictures, narrowing, intestinal obstruction. It can come in the form of a ileocecal tuberculosis forming a lump, and sometimes this lump can mimic like a cancerous growth or a tumor. Tuberculosis of the abdomen can form water collection in the abdomen and form ascites. Tuberculosis can also infect the renal system. Renal kidney tuberculosis can present with blood in urine, fever, abscess around the kidney, and it can also involve the urinary bladder, causing tuberculous cystitis. Tuberculosis can affect the bones, mainly it affects the spine, and when it involves the spine, it is called Pott's disease. Usually the spine gets deformed, sometimes paraspinal abscess formation takes place. It also causes some kind of a kyphoscoliosis, what we have seen in old classics like Hunchback of Notre Dame. In the same way, tuberculosis can affect the joint. You have tuberculosis infection of the knee or hip, where the joint gets swollen up, redness and collection of fluid. Tuberculosis can infect the synovium, the joint lining also. It can affect the skin also. For a matter of fact, it looks like there is no end to what all areas tuberculosis can affect. But please, we must try to understand this, that this is an infective agent. It means it can be prevented, and because we have medicine for it, it can be treated. And it's not right that we lose so many lives every year from a condition which is an infectious, treatable disease. So the purpose is to have a high degree of suspicion. Number one is unexplained weight loss, evening rise of temperature, feeling loss of energy, apathy. Next is a cough which is not getting relieved after the usual treatment with cough syrup and antibiotic. If you are having blood in the sputum which you are coughing out. Other than this, it can be presenting with complaints depending upon the area of involvement. It can present only with glandular enlargement. It can present like an abscess. Now, whatever it is, one needs to go to the doctor. And how do we diagnose tuberculosis? If it's a pulmonary tuberculosis, a chest x-ray sometimes is very classical diagnostics. It can show cavitations. What about any other area? If it's in the abdomen, we need to do ultrasound or CT scan. If the person is coughing, then the cough should be examined for AFB, we call acid first bacillus. This Mycobacterium tuberculosis, if it is there, we can actually do staining with acid first bacillus. If that is present, then it can have tissue culture. We can grow it in any another place, animal, to see whether we are able to grow Mycobacterium tuberculosis, this particular bacteria. Once it is diagnosed, that the next question comes, what is the treatment? As I said, it's an infectious disease, so it's a treatable condition. So there is anti-tuberculosis drug. Now this is called ATT, anti-tuberculosis therapy. Now usually it's a multi-drug regime. Now one of the method, there are different methodologies, different protocols. One is called AKT4. Now what is this K? Because you remember I said Dr. Robert Koch, who actually discovered this bacterium, and in his honor, tuberculosis is also known as Koch's disease. Because the word TB and tuberculosis has got a social stigma attached. So many times doctors prefer to refer as a patient that patient with Koch's disease. So that's why in the treatment we call AKT4, anti-Koch's therapy 4-drug regime. So what are these 4 drugs? Isoniazid, which is INH, rifampicin, ethambutol, and pyrazinamide. These 4-drug regime is given usually for 2 months. That's why it's called AKT4 for 2 months, and after 2 months usually reduced to 2-drug regime, which is continued for 4 months. And anti-Koch's therapy usually is continued for 6 months in total. Depending upon the case and reassessment, sometimes it can be continued for a month or 2 longer. Sometimes spinal tuberculosis, where there is still evidence of residual disease, one can give the treatment for a longer time. What about indications of surgery? Now, if there is collections of pus formation in the chest wall, if there is pleurisy, pleural effusion, these fluid may have to be drained. If there is lump formation in the intestine and that ileocecal area, they may have to be resected and rejoined. If there is stricture in the intestine, that particular segment might have to be removed. If there are neck glands, and if there is sometimes rarely axillary glands develop tuberculosis and form abscess, these areas might have to be drained, or with a needle you can aspirate the pus out and put these people on anti-tuberculosis treatment. So now we have understood what is the drug therapy, we have understood which are the situation where we have to do surgery. So what is important is to spread the awareness. People with tuberculosis tend to lose weight, malnutrition. So what is very important is the diet of a tuberculosis patient. The diet is not going to cure tuberculosis, but a malnourished person with tuberculosis, it may get very, very serious condition. So it's very important to have 3 square meals a day, and it should consist of pulses, cereals, fruits, vegetables, and also high protein foods like fish, egg, and chicken and meat. Now, milk. Unless these people are given rich, nutritious food, they will not be able to fight this with their own immunity and body resistance, because some of the people in rare condition end up developing long-term tuberculosis, and they develop multi-drug resistant tuberculosis. These are very special situations. These people will need very specialized care by experts in tuberculosis with the help of certain injections and probably institutionalized care. So basically what we are trying to do is, on 24th of March, World Tuberculosis Day, we are trying to make people aware of this situation, that we must fight this disease. This is a curable disease, and this is the reason. In India, we have a system called DOTS, Directly Observed Therapy Short Term, in which case in the different rural areas, we distribute anti-tuberculosis drugs to the patients, which is supervised by the relatives to make sure they don't miss any dose. Well, we have one good news also. There is a vaccine, BCG. Children are given BCG vaccine, and this puts immunity in them to fight the disease Mycobacterium tuberculosis can cause. This is one reason. Another thing I want to tell, that tuberculous bacteria cannot survive in cold and in high altitude. And that is one reason people who live in high mountain areas do not develop sufficient immunity. And these people, when they come down in land area, they are exposed and they suffer from tuberculosis. So what is important is, in our area where we are continuously exposed to subclinical disease, we have had our vaccination, our body is ready to fight the Mycobacterium tuberculosis. It's like in this part of the country where we are eating all kind of food and we have gut resistance, but people who land up from Western world who have never eaten this kind of food, they developed all kind of gastrointestinal disease. So it is important that all kids be given the BCG vaccine. It is important that we should have high degree of suspicion, and the slightest doubt, go to the nearest doctor and to detect and immediately treat. And one who is contagious, which means one who is going to be spreading the disease, that person should be isolated. Well, if you have enjoyed watching this video, please like, share and subscribe to my channel, and keep watching more such interesting videos on healthcare, education, our charitable trust, Genesis Educational and Charitable Trust activities, and food and beverage from our Ecclesiastes, the Health Cafe. Thank you very much for watching.